Hey there, friends. Welcome back to Kind Care Seniors. I'm so happy you're here with me today. We talk a lot about heart health, joint health, and staying strong as we age, but there's one organ that doesn't get nearly enough attention, and it's absolutely critical to your survival. I'm talking about your kidneys. These two fist-sized organs are working around the clock to filter toxins, balance your fluids, and keep your blood pressure in check. But here's the scary part. Certain everyday habits, things you probably do without even thinking, could be slowly damaging them. Today, we're counting down the top 10 daily behaviors that are quietly sabotaging your kidney health. And trust me, number 1 is going to surprise you. Before we jump in, drop a comment and tell me, where are you watching from and have you ever worried about your kidney health? All right, let's get into it. So imagine this. You wake up one morning feeling fine, but deep inside, your kidneys are struggling. No pain, no warning signs, just silent damage building up day after day. Scary, right? The truth is, kidney disease is often called a silent killer because by the time you notice symptoms, significant damage has already been done. Dr. Emily Carter, a leading nephrologist and kidney health expert, says that most people don't realize how fragile their kidneys actually are and how easily daily habits can push them toward chronic kidney disease. Here's the thing, your kidneys don't complain. They don't give you clear signals until they're already in serious trouble. That's why prevention is everything. So today, I'm breaking down the 10 worst habits for your kidneys, from number 10 all the way to number 1, which is the absolute worst offender. If you care about staying healthy, independent, and avoiding dialysis or kidney failure, you need to watch this all the way through. Let's start with number 10. Number 10, holding in your urine. Okay, we've all been there. You're in the middle of something. Maybe you're stuck in traffic, or you're in a meeting, or you're just too comfortable on the couch to get up, so you hold it. No big deal, right? Wrong. When you consistently ignore the urge to urinate, you're putting unnecessary pressure on your bladder. Over time, this can stretch and weaken your bladder muscles, making it harder to fully empty your bladder later. And when your bladder doesn't empty completely, urine sits there, giving bacteria a perfect breeding ground. That's how urinary tract infections, UTIs, start. But here's where it gets worse. If those infections travel up to your kidneys, they can cause serious kidney infections, which can lead to permanent damage. Plus, holding your urine gives minerals more time to crystallize, and that's how kidney stones form. And trust me, kidney stones are incredibly painful. The fix? Simple. Go to the bathroom when you need to. Don't wait. Your kidneys will thank you. Number 9, overusing painkillers. All right, next up, painkillers. We're talking about over-the-counter, non-steroidal anti-inflammatory drugs like ibuprofen, aspirin, and naproxen. These are the go-to pills for headaches, back pain, arthritis, you name it. And yes, they work. But here's the problem. They reduce blood flow to your kidneys. When your kidneys don't get enough blood flow, they can't filter waste properly. And if you're taking these painkillers regularly, especially if you're popping them like candy, you could be causing serious, permanent damage. This condition is called analgesic nephropathy, and it's a leading cause of chronic kidney disease. Dr. Emily Carter tells her patients that if you're reaching for painkillers more than a couple of times a week, something's wrong. Either you need to find a safer alternative, or you need to address the root cause of your pain. So what can you do instead? Try natural anti-inflammatories like turmeric, ginger, or omega-3s, and always talk to your doctor before taking painkillers long-term. Number 8, not drinking enough water. Water is life, literally. Your kidneys need water to flush out waste and toxins from your blood. Without enough water, your kidneys are basically trying to do their job with one hand tied behind their back. When you're dehydrated, your urine becomes more concentrated, and that irritates your kidneys and makes kidney stones more likely. Plus, chronic dehydration can slowly reduce kidney function over time. Now, how much water should you drink? The old 8 glasses a day rule is a decent guideline, but it really depends on your activity level, climate, and overall health. A good rule of thumb, if your urine is dark yellow, you're not drinking enough. Aim for light, pale yellow. Keep a water bottle with you. Sip throughout the day. Make it a habit. Your kidneys and your whole body will feel the difference. Number 7, eating too much salt. Salt is everywhere. Processed foods, restaurant meals, even healthy snacks. And while your body needs some sodium to function, too much salt forces your kidneys to work overtime to filter it out. Over time, this extra workload damages your kidneys and raises your blood pressure, which is one of the leading causes of kidney disease. High sodium also makes your body retain water, which increases blood volume and puts even more strain on your kidneys. Plus, excess salt increases your risk of kidney stones. Here's the fix. Cut back on processed and fast foods, which are loaded with hidden sodium. Instead, use fresh herbs, lemon juice, garlic, and spices to flavor your meals naturally. Your kidneys and your heart will thank you. Number 6, eating processed foods. Processed foods are convenient, cheap, and tasty, but they're also terrible for your kidneys. Why? Because they're packed with sodium, sugar, unhealthy fats, and preservatives, all of which put extra stress on your kidneys. The high sodium content raises your blood pressure. The added sugars can lead to diabetes, and the preservatives make your body more acidic, forcing your kidneys to work harder to maintain balance. On top of that, processed foods are usually low in nutrients and high in calories, which can lead to weight gain and obesity, both major risk factors for kidney disease. Dr. Emily Carter always tells her patients, if it comes in a box, bag, or wrapper, think twice before eating it. Instead, focus on whole, natural foods, fresh fruits, vegetables, whole grains, lean proteins, and healthy fats. Your kidneys will perform so much better when you give them real, nutrient-dense fuel. Number 5, ignoring high blood pressure. High blood pressure is called the silent killer for a reason. You can have it for years without knowing, and it's quietly destroying your kidneys. Here's what happens. When your blood pressure is consistently high, it damages the tiny blood vessels in your kidneys that are responsible for filtering waste. Over time, these vessels become scarred and less effective. Eventually, your kidneys lose their ability to filter blood properly, a condition called hypertensive nephropathy. And if left unchecked, this can lead to chronic kidney disease and even kidney failure, which means dialysis or a transplant. The scary part? Most people with high blood pressure don't feel any symptoms until the damage is already done. That's why regular blood pressure checks are so important. Dr. Emily Carter recommends checking your blood pressure at least once a month at home, or more often if you have a history of hypertension. And if your numbers are high, work with your doctor to bring them down through diet, exercise, stress management, and medication if necessary. Protecting your blood pressure is one of the best things you can do for your kidneys. Number 4, eating too much sugar. Sugar is sneaky. It's hidden in everything. Sauces, breads, yogurt, salad dressings. Even foods that don't taste sweet are often loaded with it. And while an occasional treat is fine, consistently eating too much sugar can wreak havoc on your kidneys. First, sugar leads to weight gain and obesity, which puts extra stress on your kidneys as they struggle to filter toxins and maintain fluid balance. Second, a high-sugar diet dramatically increases your risk of type 2 diabetes, and diabetes is the #1 cause of kidney failure. When your blood sugar is chronically high, it damages the blood vessels in your kidneys, leading to a condition called diabetic nephropathy, and once that damage is done, it's often irreversible. Sugar also raises your blood pressure, which, as we just talked about, further damages your kidneys. So what can you do? Start reading labels, cut back on sugary drinks, processed snacks, and desserts. Choose natural sweetness from fruits, and use spices like cinnamon or vanilla to add flavor without the sugar. Your kidneys and your waistline will thank you. Number 3, smoking. Everyone knows smoking is bad for your lungs and heart, but did you know it's also terrible for your kidneys? When you smoke, toxic chemicals enter your bloodstream and travel to your kidneys, where they cause inflammation and damage the delicate blood vessels. This reduces your kidney's ability to filter blood efficiently, leading to a buildup of toxins in your body. Smoking also reduces blood flow to the kidneys, which further impairs their function and increases the risk of chronic kidney disease. And here's something even scarier. Smokers are significantly more likely to develop kidney cancer, a deadly and aggressive disease. The risk is especially high if you've smoked heavily or for many years. But here's the good news. Quitting smoking can have immediate benefits for your kidneys. Within weeks of quitting, your circulation improves, reducing stress on your kidneys and lowering your risk of further damage. Dr. Emily Carter says it's never too late to quit. There are tons of resources available: nicotine replacement therapies, support groups, counseling, so don't hesitate to reach out for help. Your kidneys and your whole body will start healing the moment you stop. Number 2, drinking too much alcohol. A glass of wine here and there, that's probably fine. But drinking excessively can seriously damage your kidneys. Here's why. Your kidneys are responsible for filtering toxins out of your bloodstream, and alcohol is a toxin. When you drink heavily, your kidneys have to work overtime to process and eliminate it. This causes dehydration, which puts enormous stress on your kidneys. Dehydration reduces blood flow to the kidneys, making it harder for them to filter waste and maintain a healthy balance of fluids and electrolytes. Chronic heavy drinking can also damage your liver, and since your liver and kidneys work together to detoxify your body, liver damage often leads to kidney damage too. Plus, excessive alcohol raises your blood pressure, which, as we've discussed, is a major cause of kidney disease. Over time, heavy drinking can lead to alcohol-induced kidney disease, where your kidneys lose their ability to function properly. So what's a safe amount? The general guideline is no more than 1 drink per day for women and 2 for men. If you find it hard to stick to those limits, talk to your doctor or consider joining a support group. Your kidneys will be much happier and healthier without the constant toxic load. Number 1. Neglecting diabetes care. And here we are. Number 1. The absolute worst habit for your kidneys: ignoring diabetes. Diabetes is the leading cause of chronic kidney disease and kidney failure. Period. When your blood sugar is consistently high, it damages the tiny blood vessels in your kidneys. Over time, they become scarred and lose their ability to filter waste and fluids. This condition is called diabetic nephropathy, and it's one of the most common and most preventable causes of kidney failure. Here's the scary part. The damage happens slowly and silently. You won't feel it until your kidneys are already in serious trouble. That's why managing diabetes is absolutely critical. Dr. Emily Carter tells her patients that if you have diabetes, protecting your kidneys should be your top priority. That means checking your blood sugar regularly, taking your medications exactly as prescribed, eating a balanced, low-sugar diet, exercising regularly, managing your blood pressure and cholesterol. It also means working closely with your doctor to catch any early signs of kidney damage before it's too late. The good news? If you stay on top of your diabetes care, you can significantly reduce your risk of kidney disease and keep your kidneys functioning well for years to come. But if you ignore it, the consequences can be devastating. Dialysis, transplant, or worse. Your kidneys are counting on you. Don't let them down. All right, friends, there you have it. The 10 daily habits that are silently destroying your kidneys. From holding in your urine to neglecting diabetes care, each of these habits can cause serious, long-term damage if you don't take action. But here's the good news. Now that you know what's hurting your kidneys, you can make small changes to protect them. Start with 1 or 2 habits from this list. Maybe it's drinking more water. Maybe it's cutting back on salt. Maybe it's finally getting your blood pressure checked. Whatever it is, take that first step today. Your kidneys are essential to your health, your independence, and your quality of life. Taking care of them is one of the best investments you can make in your future. If this video helped you, please hit that like button and share it with someone who needs to hear this. And don't forget to subscribe to Kind Care Seniors so you never miss our health tips and advice. Drop a comment below and tell me, which of these habits do you struggle with the most? And which one are you going to change first? Thanks so much for being here. I'll see you in the next video. Take care of yourselves and your kidneys. You deserve to feel healthy and strong every single day.